In this presentation, we will discuss how to build energizing capacity in your partnership. As you may recall from building foundational capacity, the practical playbook was developed as a collaboration between Duke University and the de Beaumont Foundation. The link to the playbook is on the screen and will also be listed on the online course. The practical playbook is an important resource for you. It contains strategies organized across 5 categories: organize and prepare, plan and prioritize, implement, monitor and evaluate, and sustainability. We work closely with playbook investigators to identify strategies that promote energizing capacity. Some typical aspects of energizing capacity include aligning goals and objectives through collaborative activities, such as joint strategic planning, community health assessments, and grant proposals. Use of electronic health records to increase data sharing capacity with a population health focus. For example, primary care could share population-level data with public health to help identify disparities, trends, or high-risk populations. A specific example happened in a Minnesota county that was convinced that they had higher rates of diabetes in certain populations, but couldn't obtain data by population subgroups from their community health survey. When they were able to look at electronic health record data, they could cut it more deeply and found their Hispanic population had very high rates of diabetes compared to the population overall. Creating formal structures and agreements. Look to existing models to see what works. This is energizing because it is described as an actual thing that occurs. For example, something tangible like a memorandum of understanding or plans of what the partnership is expected to look like, beyond thinking of it as a partnership in spirit. Sharing resources and staffing. Some local jurisdictions are jointly funding a full-time equivalent to focus on and promote collaboration. Community engagement. These sectors can work together to tap into community needs and priorities. This has traditionally been the purview of public health, but primary care is expected more and more to look beyond their walls, and this includes thinking beyond their clinic population. On a broader level, creating training opportunities in both fields that focus on cross-sector collaboration can build tangible skills in our workforce. As we mentioned in the foundational capacity section, the practical playbook offers a menu of strategies to help promote partnership and collaboration. As you can see in the example above, we have worked with practical playbook staff and various state and local stakeholders to crosswalk key study findings with strategies available in the practical playbook. We'll do the same as with the foundational capacity section. First, take a moment to review this chart. Notice that there are 4 columns: dedicated funding and FTE, share and use data, specific project focus, and the last column, create formal structures. Note the left side of the table that gives you ideas for organizing, planning, implementing, and monitoring. On the next few slides, we'll look at this in detail. First up, dedicating funding and full-time equivalents. For any partnership to be successful, you need some level of dedicated staffing. It's possible to do this work without direct financial support, but you definitely need people to make it happen. Right from the beginning, you need to think about what resources are needed to support this work. What are the barriers to sharing resources between partners? And what is needed to create a sustainable partnership? For example, once current leadership or staffing is no longer in their roles, can the partnership continue? One example we already mentioned was creation of a jointly funded full-time equivalent to support the collaborative work. That is not the only way to do this, but is a good example of an approach that is working for some local jurisdictions. Throughout the partnership, it is helpful to evaluate how things are going. Is the current staffing structure sufficient to complete the work? What's going well and what is lacking? With regarding to sharing and using data, this is a perfect opportunity to come together on a resource that is typically already in place. Leveraging electronic health record data is a perfect example of using existing data for another purpose, namely addressing population health topics. Public health brings expertise in interpreting and understanding population health data, and typically, as long as aggregate, de-identified data is used, data privacy barriers are minimized for the partnership. If you have the opportunity to come together and review population health data, whether electronic health records, population surveys, vital statistics, whatever the source, look for interesting patterns, disparities in health behaviors or outcomes. Really look to identify the hot spots in your community. If you have mapping or spatial modeling capabilities, all the better. It is critical to engage all your partner stakeholders in data review, interpretation, and prioritization so that you have a community health perspective represented. Finally, continue to monitor and evaluate your data sources. Do you have the right ones? Do they have enough rigor upon which to base decisions? A great way to build energizing capacity is to look for a specific project focus on which to begin. Are there some easy projects that appeal to both sectors and clearly align with goals and objectives from both? If so, take advantage of the opportunity. To really get started, you need to identify key roles and responsibilities for both partners to implement your project. There are good examples in patient-centered medical home or healthcare home models, as well as accountable communities for health. As you're implementing, general project management skills are important. Set and monitor your deadlines, make sure that you're staying on task, and follow up if a specific task is lagging behind. It is also helpful to set up your evaluation questions at the beginning of your project, so you're sure to be collecting and monitoring the data you needed to evaluate your project throughout the process. Our final example today relates to creating formal structures and agreements. There are several models from which to choose, including Memorandum of Understanding, formal contracts, shared organizational charts. Think through what will work best to fit your work. You will likely need to consider the governance structure needed and whether you need to determine policies, procedures, and protocols needed to support the work. You don't need to recreate the wheel on all of these. There are several good examples of formal mechanisms to support partnerships. You can tailor templates from successful partnerships to suit your needs. Finally, as you reassess project goals and objectives, think about whether these are reflected in your formal documentation and make changes as needed. In the next section, we'll have an opportunity to review, reflect, and share.